Previous research has looked at links between COVID-19 mortality and population-based exposure to nitrogen dioxide, ozone, and particulate matter. Though lockdowns lowered air pollution levels according to some research, other studies have linked higher levels of pollutants to increased levels of COVID-19 infection, hospitalization, and death. A study out of Harvard University, not yet peer-reviewed, is looking at long-term effects of particulate matter on COVID-19 deaths. It reports that people who live in a county with high levels of fine particulate pollution are 8% more likely to die from COVID-19 compared to someone in a region that has 1 microgram per cubic meter less. The nation has known for some time that long-term exposure to particle pollution can worsen symptoms of lung disease, increase susceptibility to lung infection, trigger heart attack and stroke, and can even cause lung cancer and premature death, Harold Wimmer, President and CEO of the American Lung Association, ALA, said in an April statement. This new research from Harvard now links particle pollution exposure to a dramatically higher death rate from COVID-19. He cited the EPA's efforts to update the air standards and said the ALA wants a significant strengthening of the annual standard. The EPA proposed keeping the standard as is. These findings illustrate that far too many Americans are facing multiple threats to their lung health at once, and when taken together, these different threats to lung health impacts can amplify each other, Wimmer said. Even as the Lung Association and the nation respond to the urgent health needs of the COVID-19 crisis, we cannot afford to delay cleanup of dangerous air pollution. In fact, it is more important than ever. Researchers from the Netherlands also looked at air quality readings gauging levels of nitrogen dioxide, sulfur dioxide, and fine particulate matter. Areas with higher pollutant levels typically had more COVID-19 cases, hospitalizations, and deaths. Petroni hopes their latest study will trigger more research into what constitutes safe levels of chronic air pollutant exposure. Our main goal was to test the emerging hypothesis that air pollution risks and COVID-19 mortality risks are related, he says. The findings are based on county averages and do not yet have the specificity needed to make any individual level conclusions.